Nclex Pn Questions. After cataract surgery, instruct the patient to sleep in which position? On back or non-operative side? Can abandonment charges be filed against nurses who walk out as staffing is inadequate? Yes. Can a nurse sign or be a witness to a signature for a living will for her patient? No. Must be signed by someone who isn't staff or be notarized. Can a patient with a fast respiratory rate be susceptible to insensitive fluid loss? Yes, from the lungs. Can a prescription for a restraint be used PRN? No. Can lipid solutions be given to patients with egg allergies? No. Can needles be capped? No, but if you have to, use a mechanical device to recap. Can nurses adjust or change a patient's medication? And only the doctor can do this. Can nurses refuse to float? No, unless their union contract states they only work in a specific area. Can potassium be administered via for push? No, only for orally. Can potassium supplement be taken on an empty stomach? No, causes nausea and emesis. Can safety devices, restraints be prescribed by a nurse? No, only a HCP can prescribe. Can the nurse speed up and for infusion rate if the schedule is running late? No. Can you give a patient hard candy to relieve thirst? Yes. Can you use the arm that has an infusion going for blood draws? No, it can give inaccurate results. Try and draw blood 1 hour prior to intermittent heparin. Can you write on the outside of 4 bags? No. Use a label instead. Clenching, unclenching of the fist during a blood draw can cause what inaccurate result? Potassium level. A client with a Sengstaken Blakemore tube in place to treat esophageal varices suddenly becomes restless, the heart rate and blood pressure increase. What is the immediate nursing action? Cut the tube and pull it out. Do incident reports get filed in the patient's record? No. Do nurses need to get their own insurance against malpractice? Yes. Drugs that end in lol are normally used for what? Beta blocker for hypertension lowers the BP. During cardiac catheterization, what position should the patient be in? Head elevated no more than 30 degrees. Foods low in potassium, applesauce grapes, blueberries, raspberries, most green veggies. For CPR purposes, a child is defined as what age range? 1 through 8. For statulicensing, contact state in which you are taking the Nclex and determine specific requirements for that state. For vaginal or anal exams, what should the position be? Lithotomy. Fowlers and semi-fowlers is what position? Semi-sitting with head raised. Gram measures, gram mass. Hold off on giving the patient blood if the temp exceeds 100 F. How are central venous catheters position determined? SRE. How are drops abbreviated? GTT. How are platelets administered? Rapidly over 15 to 30 minutes. How can you determine the patient's BMI? Divide the weight kilo by the height meters squared. How fast should intermittent feedings last? Administer over 30 to 60 minutes. How is anthrax contracted? Direct G, skin, inhalation. How is a telephone medication order abbreviated? T.O. How is smallpox contracted? Air droplets, highly contagious. How long prior to surgery should a client discontinue aspirin use? 48 hours. How long should the nurse remain with the patient who has just received a blood transfusion? 15 mins. How long should the patient fast before a glucose study? 8 to 12 hours. How long should you hold pressure on a draw site if patients are taking anticoagulants? 5 to 10 minutes, 3 to 5 minutes for a coagulation defect. How many of the 30 compressions should you let completely recoil during CPR? 23 of the 30. How often should you check on a patient who is receiving fluid replacement therapy? Every hour. How often should you check the circulation of a patient with restraints? Every 30 minutes. Loosen every 2 hours. How often should you empty a chest tube drainage chamber? Never, due to the risk of collapsing a lung. How often should you monitor the VS of a patient receiving lipid solutions? Every 10 minutes. Monitor for reactions the first 30 minutes. How often should you turn a post-operative client that can't get from bed? Every 1 to 2 hours. How should you administer regular and NPH insulin? Mix both in the same syringe regular than NPH. How soon after the administration of nitroglycerin should the patient see relief? 5 mins. Burning sensation, vertigo are common side effects. How soon should blood return to the hand after the Allen test? 6 to 7 seconds. If it takes longer, use a different hand for blood draw. If a patient is experiencing dyspnea and has an elevated BNP, what is the diagnosis? Heart failure. If the BNP is normal, then the dyspnea is a result of respiratory distress. If the PTT value is prolonged longer than _____ seconds in a patient receiving heparin, initiate bleeding precautions. 90 seconds. If the patient has a reaction to blood, where should the blood bag be returned to? Blood bank. If the PT value is longer than ____ seconds in a patient receiving warfarin, initiate bleeding precautions. 30 seconds. In acidosis, the pH is up or down. In acute pancreatitis, the amylase levels may exceed how many times the normal limit? 5 times. Levels start rising around 6 hours of the onset of pain, peaks at 24 hours. In alkalosis, the pH is up or down, up. In chronic pancreatitis, the serum amylase levels may increase how many times the normal limit? 3 times normally does not exceed 3. Iron supplements should be taken with what? Vitamin C rich juices, tomato juice, orange juice. Is the Nclex exam administered in other languages? No. Only in English. Not enough essential fats in the diet can lead to what? Amenorrhea, sensitivity to cold, skin lesions, risk of infections. The older patient is at risk for falls due to what? Changes in the neurological and musculoskeletal systems. Patients with Addison's disease are at risk for what? Hyperkalemia, hypotassium. A patient with hyperparathyroidism is likely to have elevated calcium levels. Which foods should they avoid? Dairy products such as milk, cheese, ice cream, or yogurt. Reduce symptoms of Raynaud's disease. Wearing gloves when handling frozen food. TEF case management involves collaboration with an interprofessional healthcare team. True. TEF Catholics, Christians, and Jehovah's Witnesses are the only religions that allow organ donations. True. TEF Orthodox Judaism may allow organ donation with the rabbi's approval. True. TEF patients should consult a doctor before taking OTC or any herbal preparations. True. True, false. Patients with liver disease have prolonged clotting times. True. Washed red blood cells may be ordered for what types of issues? 1 recent allergic reaction to transfusion. 2 recent stem cell transplant. Water loss through the skin and lungs. Expired air is called insensible loss. What for patients may be at risk for third spacing? Renal failure, sepsis, liver cirrhosis, burns major. What are a few foods high in riboflavin? Milk, lean meats, fish, grains. What are a few high purine foods? Anchovies, herring, scallops, mackerel, wild game, sweetbreads. What are incident reports used for? Identifying risk situations and improving care. What are normal magnesium levels? 1.6 to 0.6 milligrams. What are signs of elevated magnesium levels? Drowsiness, sedation, lethargy, muscle weakness, areflexia. What are the 3 post-operative stages? Immediate 1 to 4 hours, intermediate 4 to 24 hours, extended 1 to 4 days. What are the 3 systems of personality? ID, ego and superego that have different operating principles, but in a mature, well-adjusted personality, they work together under the command of the ego. What are the 5 types of leaders? 1 autocratic, dominates the group, maintains strong control and address problems with clearly defined tasks. 2 democratic, participative style, all members of the team should have input. 3 laissez-faire, passive, inactive and delegates responsibility to the group. Lazy. For situational leads based on current circumstance, situation. 5 bureaucratic, leader believes that the team is motivated by external forces, relies on policies, procedures for decision making. What are the components of a medication prescription? Date, time, med name, dosage, route, frequency, signature. What are the fat-soluble vitamins? A, D, E, K. Excess causes toxicity. What are the normal, average pH levels of the stomach? 1.5 to 3.5. What are the parts of bleach, water solution to use for disinfection? 1 to 10. What can happen if you abruptly stop the N solutions? Hypoglycemia. Decrease slowly. What does a pericardial friction rub sound like? Loud booming, muffled heartbeat. What does extracellular mean? Fluid outside the cells. What does interstitial mean? Fluid between the cells and the blood vessels. What does the respiratory rate do with acidosis and alkalosis? Acidosis RR increases. Alkalosis RR decrease. What else should be performed when a patient is receiving potassium supplements through 4? Cardiac monitoring. What food does the lacto-vegetarian not eat? Eggs. Lacto-ovo-vegetarians eat eggs. What ID? Third spacing. The accumulation of extracellular fluid in a body space due to disease or injury. What is a common adverse reaction to medication in the older patient? Change in mental health status. What is a concern when a patient is taking warfarin? Bleeding easily. Educate patient on straight razor use. What is a mechanical diet? Meals that are prepared for easy swallowing. Avoid nuts, dried, salty foods. What is an early sign of digoxin toxicity from the drug digoxin? Anorexia. What is an insensible fluid loss? Can't be measured through skin and lungs. What is reflexia? Absence of the reflexes. What is autonomic dysreflexia, and which position should the patient be placed in? Caused when a painful stimulus occurs below the level of spinal cord injury. High Fowler's position. What is considered a normal blood glucose level? 70 to 100. What is dystocia, abnormal labor or childbirth? What is enteral nutrition? Feeding through the G-tract. What is habeas corpus, and can a mentally ill patient request it? Requesting a release from care, yes they can. What is hypokalemia, a potassium level lower than 3.5 mEq/L? What is interpersonal and intrapersonal conflict? Intra within a person, inter within the group. What is managed care, strategies to reduce the cost of healthcare? What is parenteral nutrition PN? Feeding through a vein, last resort. What is phlebitis, inflammation of a vein? What is priority 1, 2, and 3 of the emergency room triage? Priority 1 emergent chest pain, respiratory distress, major arterial bleed, chemical splashes to the eye. Priority 2 urgent not life-threatening, unless not treated within 1 to 2 hours. EVIL every 30 to 60 minutes. Priority 3 minor issues, EVIL every 1 to 2 hours. What is Raynaud's disease? Reduced blood flow due to spasm of arteries of the feet and hands. What is the first step in the nursing process? Data collection. What is the first step when looking into the NCLEX exam? Step 1. Access the NCSBN website at www.ncsbn.org. Obtain info for international nurses. What is the second step in the nursing process? Planning. What is the third step in the nursing process? Implementation. What is the fourth step in the nursing process? Evaluation. What is the allostatic applying pressure to the arteries in your wrist? What is the antidote for magnesium overdose? Calcium gluconate. What is the best way to turn a patient who has had spinal surgery? Logrolin. What is the drug Questran used for? Lower cholesterol. What is the first step in the calculation of dosages? Conversion. What is the immediate action to take after a heart failure patient presents with shortness of breath, dyspnea? Raise the head of the bed. What is the limit of time a caregiver should be exposed to radiation per shift? 30 minutes max. What is the medication Tigan used for? Nausea and emesis. What is the most common position for a cardiac or respiratory patient? Head of the bed raised. What is the most common post-operative complication? Atelectasis. The collapse of the alveoli occurs 1 to 2 days after surgery. What is the normal RBC for a male and female? Female 4.0, 5.5, male 4.5, 6.2. What is the normal specific gravity of urine? 101610 to 2. What is the normal urine output of a post-operative patient? 30 milliliters every 2 hours. What is the normal WBC count? 4500110. What is the preferred source of energy? Carbs, milk, grains, fruits and veggies. What is the primary buffer system in the body? Carbonic acid bicarbonate. HCO3. What is the process for sending the state official documents? They must come from the licensing authority. What is the Trendelenburg position? Lower body raised reserved is upper body raised. What is the universal RBC donor? O negative. What is wound evisceration? And when does it normally happen? The protrusion of internal organs through an incision occurs 6 to 8 days after surgery. What is your initial response after a patient's trach tube becomes dislodged? Use a manual BVM resuscitation device. What level is the sodium when a patient has hyponatremia? Sodium level will be less than 135. What OTC tabs should patients not take with medication? Antacids tabs affects the absorption of the med. What patient is least likely to have third spacing? Diabetic. What position should a patient be that had a mastectomy? Semifowlers with affected side arm raised to heart level. What position should the patient be for an insertion of a nasogastric tube for continuous feeding? Head at least 45 degree. What position should the patient be for a nasogastric tube? High Fowler's position. What position should the patient be in for central line insertion, removal and tubing change? Trendelenburg. What position should the patient with a head injury not be placed in? Flat of Trendelenburg. What position should you place a patient who has just had a liver biopsy? Right side laying with a rolled towel under puncture site. What position should you place a patient with acute epiglottitis? Sit upright. What position to use for soap suds enema? Left side Sims position. What PPE to use for MRSA patient? Gloves, gown, goggles, mask. What should be kept at the bedside of a patient with an endotracheal or tracheotomy tube? BVM Niambu bag. What should you do if a chest tube is accidentally pulled from the site? Pinch the skin together, apply a sterile dressing and put overlapping 2 inches tape over the dressing called the HCP. What should you do when a patient who is tube feeding needs to be turned? Turn off feeding until completed. What should you do with a dislodged radiation implant? Don't touch it. What should you have at the bedside of a patient who has a Sengstake Blakemore tube inserted for esophageal varices? A pair of scissors. What should you instruct the patient to do when you remove a nasogastric tube? Take a deep breath and hold. What should you instruct the patient to do while you move a chest tube? Valsalva maneuver. What should you monitor for in a patient with severe diarrhea? Metabolic acidosis. What should you monitor for in a patient with severe vomiting? Metabolic alkalosis. What should you monitor in a patient receiving chemo due to the risk of thrombocytopenia? Platelet count. What type of candy can you offer a patient who has reduced salivary flow? Sour candy. What type of dropper should you use for children? Calibrated dropper. What type of food should a diverticulitis patient avoid? High fiber foods. When a patient has hyperkalemia, what can you expect to see on an EKG? Narrow peak T waves. When does discharge planning begin? When patient is admitted. When does the superego emerge? Phallic stage 3 to 6 years old. When inserting a catheter into a male urethra, you see the flow of urine. What should you do next? Insert another 2.5 to 5 centimeters and inflate the ballon. When noticing that the fundus of a postpartum patient is soft and spongy, what should you do? Massage the fundus gently until it is firm. When removing a chest tube, what should you instruct the patient to do? Hold breath and bear down. When residual formula is noted in a scheduled feeding, at which point would you hold the feeding? Any residual more than 100 milliliters test residual for pH balance should be 3.5 or less. When you notice blanching, coldness and edema at the foresite, what should you do? Remove the fore. Where should the PN line be placed when long-term nutrition is needed longer than for weeks? PICC is used. Where should the PN line be placed when short-term nutrition is needed for weeks or less? Subclavian or jugular vein. Which patients should be on a low purine diet? Gout. Kidney stones. Which population is at higher risk for fluid-related problems? Infants and elderly. Which population should have poison control hatched by each phone? Homes with children. Which tabs should not be crushed? Enteric-coated, sustained release tabs. Who is most at risk of contracting Clostridium difficile C. diff? Patients in hospitals who have been on multiple long-term antibiotics. Who issued the patient's Bill of Rights? American Hospital Association. Who is the universal recipient, AB positive? Who should you call first prior to attempting an intervention of a poison ingestion? Poison control. Why are the veins in the forearm most commonly used for bursitis? They provide natural support and splint. Why is a patient with a nasogastric suction at risk of potassium deficit? Potassium-rich fluids are lost through G-suctions. Why is a patient with heart failure not given saline solutions? Increases fluid overload and exacerbates heart failure. Why is a patient with kidney disease failure not supposed to receive lactated ringers? Contains a potassium solution.